What's up, guys? It's June 20th, 2018. I'm Will Grant, and we're about to do our first session of stem cell therapy with Dr. Locks. I turned pro as early as I possibly could, and 3 months into that, I ended up tearing my ACL. First race back after a year of that process, I ended up re-tearing everything. I didn't even crash. I just put my foot down and everything was re-torn. At that point, I was 19 years old, so I ended up just skipping physical therapy and just jumping right back into racing, jumping right back into training. And between skipping those crucial parts of recovery and then going right back into racing with a lot of crashes, a lot of training, I ended up doing a lot of damage on my body. I just could not get rid of this pain in my knee that just felt like would not go away. So I ended up getting it checked by a doctor, and I ended up having a big hole into my kneecap from just like a pothole from bad movements. So the process, he ended up drilling holes inside my kneecap in hopes that it would regrow back properly and just let the femur heal. Started trying to ride and train and get back into racing full time, and I was just in so much pain. And I started hearing about Dr. Locks and stem cell therapy, so I went in and met with him. Stem cells hopefully can reverse the irreversible damage that I've put on my knee in the past 10 years. And honestly, I cannot wait to give it a shot and to see my results and to show you guys my results as well.
Hi, my name is Dr. Dennis Locks. I'm a sports and regenerative medicine specialist. Regenerative medicine is the field of stem cell science, tissue engineering, scaffolds, and growth factors such as platelet-rich plasma. We utilize these to help athletes get back to sports and patients to lead more active, functional lifestyles. Will's knee is not a normal 26-year-old knee. He first injured himself when he was 16. He tore his ACL, his meniscus. He subsequently had 4 surgeries. Over the course of time, usually 10 to 15 years later after these traumatic surgeries, especially an ACL injury, you develop arthritis in your knee. So the combination of trauma plus surgery is an acceleration of the arthritic wear, and even though he's 26, it has a cumulative effect. When you then add the significance of his high intensity training, which he has to do to be a competitive BMX racer, it puts even more stress on him. Will had another surgical procedure which is called microfracture, where they drill into the bone, and the purpose of that is when you drill into the bone, you hit the bone marrow, and the bone marrow has a source of stem cells, and that seeps into the area where the cartilage is. The intent is that you're going to try to repair it and grow new cartilage. The procedure is imperfect in that when you're drilling into the bone marrow, most of the bone marrow, 95% is whole blood and only 5% is stem cells. So you usually get an incomplete healing response, and a lot of times it's fibrous tissue or scarring, so it doesn't form the most healthy tissue to recreate what normally would be in a normally functioning knee. So that is one of the reasons we're trying to use a more concentrated source of stem cells without another surgical intervention. Will is an excellent candidate for regenerative medicine and stem cells. He's complicated and simple at the same time. Simple in that you want to get him back to his sport, which is BMX racing, and you want him to function at a very elite level. And helping the body heal itself is a natural fit to try to accomplish that goal. He's complicated in that elite athletes do very significant training, which is very high impact on their body, and you have to adjust for that. And so having him heal his body without the detrimental effects of damaging more tissue through surgery, which he's already been through in the past, you're now looking at wear and tear patterns in a 26-year-old that happened when he was 16, when he first injured himself, and he's had 2 surgical interventions. So he's complicated in that aspect, but he's a perfect fit for regenerative therapy in that you do not want to keep taking more of his tissue out. An elite athlete who is subjecting their body to severe stress forces needs every bit of cartilage, every bit of their functioning as they can. One of the things that I do as a specialist, and I've been doing this a long time, and I've seen just about every type of athlete there is, no 2 patients are alike, even in the same sport. Their knee or their other joint involvement, whether it's a shoulder, you have to be specific for each particular patient. There are other doctors who approach this as cookie cutter medicine. I don't do that. I custom tailor it for each patient's individual needs. And when I first met with Will, he went through some of his training, including plyometrics, squatting 450 pounds. These things are very, very harsh on a knee. A normal person wouldn't be doing that. So we have to work around keeping him highly physically fit, highly trained from a cardiovascular and a strength standpoint without further impacting his knee and training in this style. So we have to work around that and design a program that is unique for him, but keeps him at this high level without further traumatizing his knee.